Alzheimer's and vascular dementia. Those are the two main causes of dementia. Those are the two main types of dementia. When you say dementia, it's not one disease. It's actually several diseases. It's a syndrome, meaning a group of signs and symptoms. Signs is what we can see. Symptoms is what the person is feeling. So dementia is a syndrome. It's a group of signs and symptoms. And there are some diseases that are included in that group, which Alzheimer's and vascular dementia are the main ones. So we were talking about that today. I will be differentiating between the two of them. And if you like our content, don't forget to like and subscribe. Now, the main type of dementia is actually Alzheimer's. It is 50 to 60% of cases of dementia is due to Alzheimer's. It is Alzheimer's. Whereas the vascular dementia, it's the second most common, which is around 15 to 30%. And also you have this gray area where you cannot actually identify this is Alzheimer's, this is vascular dementia. They are mixed. You have both of them, and that accounts for about 15% of those cases. And other than that, around 20%, 20 to 30%, you have other causes of dementia, other types of dementia. Now, one of the main differences between Alzheimer's disease and vascular dementia is the way that it progresses. So you can see here in this image that Alzheimer's, it's slowlier, and the progression is more slowly, it's more insidious, which means that it happens over a long period of time. It's not something that abruptly happens, but it happens over a long period of time. When we're talking about vascular dementia, it happens very acutely and in a stepwise format, which means it's like the stairs, the steps of a stair. So it happens and then it gets worse. And then it kind of stabilizes for a while and then gets worse. And then it stabilizes. So it's like the steps of a stair. In Alzheimer's, one of the first symptoms that we see is memory loss. So you forget not only where your keys are, but sometimes you forget the names of the people that you know. You forget places that are usually familiar to you. So memory loss is one of the first things that happens in Alzheimer's. Whereas in vascular dementia, one of the first signs that we see is executive function. So the person cannot do things like mobility, things that they used to do before, and also their attention. Sometimes they can pay attention to things, sometimes they cannot. Regarding motor symptoms, in Alzheimer's, in the early stages of Alzheimer's, the motor is preserved. So the gait is preserved. You don't see a lot regarding gait. Whereas in vascular dementia, it's the opposite. Right in the beginning, in the early stages of the vascular dementia, we already see gait disturbances. The person cannot walk properly and they have focus deficits. It's one specific group of muscles that is not moving right because you had a blockage in the arteries that irrigate your brain and that are responsible for that specific group of muscles. Regarding the areas of the brain where it affects, it also is different from Alzheimer's disease and vascular dementia. Now regarding how it happens, it's also very different here. In Alzheimer's disease, we have this trash that accumulates both inside of the brain cells and outside of the brain cells. It has different names, but outside of the brain cells, we have these amyloid plaques. And inside of the brain cells, we have these neurofibrillary tangles. It doesn't matter the name. What matters is it's kind of like trash. If you have your house, you have trash inside of your house, and then you have trash outside of your house. So this is trash inside of your brain, inside of the cells and outside of the cells, and that prevents each cell from communicating with each other. Besides that, you also have the neurotransmitter that does this communication between one neuron and the other. It is diminished in Alzheimer's disease. Now, in vascular dementia, it's different. Vascular dementia, it's the arteries that are not working fine. You have several mini strokes in your brain, and that causes you to have a motor function depletion and also cognitive function impairment. You have the disease in these small vessels inside of your brain, and these infarctions, these strokes, they happen in your brain cells. If you look at an MRI, you can differentiate one from another. In the Alzheimer's disease, you have a diffuse atrophy. Your brain is shrinking. Whereas in vascular dementia, you have several infarctions, you have several strokes all around, and these strokes, they cause this motor function and this cognitive function impairment. And it's specifically regarding each area that the strokes happened. Regarding causes, in Alzheimer's disease, it's very related to age. Actually, after you're 65, every 5 years that passes, you double the chances of having Alzheimer's. And actually, in people who are 90 years or older, they have around 20% chance of having Alzheimer's. It is also related to a specific genetic alteration. Now, in the vascular dementia, it's the circulatory system that's not working fine. If your heart is not doing well, your brain is not doing well either. In Alzheimer's, the problem is in the electric wires in your house, whereas in vascular dementia, the problem is in the pipes of your house. So if your heart's not doing fine, your brain is not doing fine either. And the main causes for this, and I'm closing it, you cannot see because I'm here, but it's hypertension, diabetes, and AFib. Those diseases, they can cause the vascular dementia. Now, as we said in the previous slide, in Alzheimer's, it's a gradual decline. It goes over years and years, and it's irreversible. Now, in vascular dementia, you have a stepwise deterioration, which means you have a stroke, and then the person gets worse. And then you have months, perhaps even years, in which the person is stabilized, but then you have another stroke, and then the person gets worse again. So you have this decline, which is in the format of the steps of a stair. Now, regarding how the person presents themselves to other people. In Alzheimer's disease, the social graces, they are retained, especially in early stages. So the person may be forgetting things, but they are still talking to you, they are still laughing, and you may think it's probably nothing, grandma is kind of funny today, and that actually can cause you to not diagnose early. Now, in vascular dementia, you have the opposite. You have apathy and you have depression. Some studies say that this depression is due to the person being more self-aware of what's happening to them as opposed to what happens in Alzheimer's. Regarding treatment, one of the main treatments that we use for Alzheimer's disease is this drug called cholinesterase inhibitors. So like we said in the previous slide, you have the neurons, the brain cells, and you have the neurotransmitters. And what you want to do is to have more neurotransmitters. You want your brain not to destroy those neurotransmitters that you already have. So you use drugs for that. But now, regarding vascular dementia, we have to prevent the vascular risk, and we have to prevent those strokes from happening. Now, how do we do that? We treat the diabetes if the person has diabetes. We treat hypertension if the person has hypertension. We give aspirin to prevent blood from clotting and strokes from happening. It's usually very difficult to completely differentiate one case from the other, and they are usually mixed. The Alzheimer's disease and vascular dementia, they are usually mixed, and you have at least a certain degree of each of those. But it is very important for us to be able to differentiate, to correctly diagnose, because the treatment will be different. And also we can know what to expect from the evolution of that patient. I hope you enjoyed this video and see you at your next appointment.